Welcome to 101. I'm Greg Bassey, your host from the Salisbury Independent newspaper. It's a big day here at PAC 14. We have the new president of our hospital here, Steve Leonard. Welcome, Steve.
Hey, Greg, thanks for having me.
Now, people have told me for years that you have the hardest job in our community. Is that true?
Oh, I don't think so. I think some people might think it's hard, but at the same time, I think there's a team taking care of patients in the building who they definitely work harder.
But certainly, I mean, the responsibilities are immense.
I guess they are. I mean, at the end of the day, it's a large organization, but we've got a great team that serve in leadership roles, and thankfully, things work smoothly.
Now, do you have to know as much as I think you have to know? I mean, do you have to know as much as the doctors know, and all the staff people, and the administrators, and the people who buy the equipment?
I think you probably have to know quite a bit. Thankfully, they're experts in their areas, much more than I could ever be. I think having a broad understanding of healthcare and operations definitely helps with the role. But my area tends to be one area of focus, while theirs tends to be in the area that they're working in.
Now, you've been in the area, you've been with us about 10 years?
Since 2002, actually, almost 15, 16 years now.
And so you've been involved in the hospital. Did you expect to be put in charge ever?
I think everybody takes different paths, and I remember having some early on mentoring conversations and expressing an interest in growth and development. And over the years, one thing led to another, and at some point they asked me to throw my hat in the ring, and sure enough, this is where I find myself.
And you were in the operational side.
I was, yes. Yep.
So what was your previous job?
So I was the vice president of operations. So I, along with the chief nursing officer, report to the chief operating officer, really focused on stuff that happens, as we say, in the big house. So a lot of the areas in the hospital that I would support included things like IT, pharmacy, lab, mostly the operational areas, and a couple of clinical areas as well. So it really was an opportunity to get to know the hospital, inside and out.
Right. Now, we've always heard with the people who are the executives, the CEOs, presidents, some of them are like pro-nurse, pro-doctor, pro-patient, pro-administrator. Are you, any idea where you come from?
I'm pro-team, quite frankly. I can say we have the best medical staff. I can say they're supported by the best nursing staff, and then a whole host of support behind the scenes that really allow them to do their jobs well. So I know full well that from a leadership perspective, we couldn't get the job done that we do here without the team, and that's really the doctors, the nurses, and the whole support team.
And a lot of people don't understand really how the doctors work. The analogy I finally came up with is that you run the civic center, basically, and the doctors are Willie Nelson. They come in and they perform in your facility.
Sure.
They have to do what's right inside your house, but really they're their own kind of guys.
There's different relationships that hospitals have with the medical staff. Some are, in a traditional sense, some are volunteer medical staff. In other words, they're self-employed out into the community. They have vibrant practices and so forth. Some physicians are employed directly by the hospital, and some are contracted by the hospital to provide a certain service. An example might be our emergency department physicians or anesthesia and so forth. So quite honestly, they're all part of the team. And that technicality about what kind of bucket they fit in doesn't matter as much as that they're part of the team and they help really take care of the patients and drive the clinical process.
And historically, that's where the problems have sort of come up. Like there's a problem with the anesthesiology team, or the contract, the emergency department was an issue a bunch of years ago. But that seems to have gone away. We're not hearing these problems anymore.
I think I'd knock on wood, but I can't find any Greg in the studio. Anyway, I think we've got a good team. Our emergency departments, emergency services associates, our anesthesia company, the contracted folks, the volunteer, the employees. We employ more and more folks these days. I think we're up in the 70s in terms of physicians that are employed by the hospital at this point in time.
Right.
So again, we've got a great medical team, and we've had some great recruiting success over the last couple of years. It really is a place that I can honestly say I take part in most physician interviews that come in the building. And if we can get them here into Salisbury and at the hospital, we got a good chance at recruiting them because it's a great place for doctors to work.
Right, you hear that being the issue. Nurses and doctors are going to be in demand more than ever, so the recruiting goes well.
We're fortunate. I'll take the nursing from a nursing perspective. Probably about 10, 12 years ago, there was definitely a shortage nationally. But if you look at the academic institutions we have here in the community, whether it be Warwick, Salisbury University, Del Tech, Wilmington College, we're incredibly fortunate that they are really providing the scope of services they offer with nursing education, which has really helped us attempt to, we're not quite always ahead, but we're definitely not as far behind from a nursing recruitment perspective as some areas of the country. And I attribute that to the great academic institutions we have in the region. On the doctor side, I think the industry nationwide is challenged. We're not graduating as much as we probably could, especially with an aging population. We're doing well though when we're able to bring them here and recruit them. We've had a couple good years as well. Other roles are becoming more and more important. Advanced practice professionals, folks like nurse practitioners, physician assistants, certified registered nurse anesthetists. There's a whole scope of folks out there that are important in supporting the doctors in their role.
So the Warwick program is really successful in terms of helping the hospital, and just recently there was news that Salisbury University is increasing its healthcare program, which is going to help you all too.
Yeah, they just recently announced they're consolidating their health-related education into the College of Health and Human Services, which I think is a great step. It's kind of one of those things that you kind of look back and said, I wonder why they didn't do this sooner. But they have so many different health-related specialties that they're now bringing them under one college. That's important because healthcare these today is a team sport. So the age of educating nurses in one silo, respiratory therapists in another silo, social workers in another silo, they're really going to be able to bring that education to an interdisciplinary approach, which I think is going to help us have a stronger team in the long run.
Right, and the X-ray programs are amazing too. Warwick's got a really good X-ray program that I hear about all the time.
They do. X-ray's one of those little unsung heroes because they do such important work, and it's a really hard program.
Right.
I mean, it is really hard. You talk to the folks
the success rate there is kind of low.
I can't quote the passing rates. I just know it takes incredible discipline, and they put out a great product. And we see folks come into the hospital, especially when they're doing their clinical work, finishing up education, then as employees, and they're wonderful.
And the relationship too with the EMTs out in the field, the emergency people that come to you in the ambulance, that's incredible how it's all coordinated.
It definitely is. And what's fascinating is some of the programs now where we're partnering with local EMS to actually have clinical caregivers go into people's homes. So now we're partnering with Salisbury Fire Department to actually have a nurse practitioner actually proactively go into people's homes to do assessments, see how they're doing in life for those folks who happen to call 911 often. So I would suspect that over time that relationship becomes even stronger.
Now that's something you guys are under a lot of pressure for, is to keep people healthy. You wouldn't think about being the preventative thing, but the news releases I get from you all are amazing. How you reach out to the community to try to get people thinking about being overweight and things like that, and to have programs that can actually help people. And there's so much of that goes on. But you're under like some sort of federal or state pressure to do that.
So yeah, great topic. Nothing's off limits.
Right.
Maryland is a unique state. We're heavily regulated. So hospitals that operate in this state are really operating differently than anywhere else in the country. So the national stuff, it's there, but it's not as important as the stuff that happens here at the state. And the state's very cost conscious about healthcare expenditures, and they actually motivate all hospitals and health systems to really focus on health and wellness. So not only are we there when you're sick or injured, and we'll always be there because we have a great institution, but going forward, actually since 2013, there's been motivation for us to figure out how do we engage the population to live healthier and well lives so that they perhaps might not need us as soon or as often into the future. So that's definitely it's a focus of us in our new strategic planning process, is really reaching out into the region and really engaging people closer to homes and focusing on being healthy and well.
And there's a lot of pressure too to keep people from being admitted to the hospital, to take care of them in their home or close to their neighborhoods.
Definitely. I think when you look at the different levels of care, I think we're always trying to do things in the right place at the right time. And sometimes things that come to the hospital really could be taken care of in a physician's offices. So those are things we're going to be looking to engage the community on. And perhaps if the primary care physician's not available, urgent care is a wonderful setting as well for some of those lower intensity things. This way it leaves the places like our trauma center able to more better focus on the more complicated emergencies. So urgent care and primary care are definitely going to be two things we're focusing on heavily.
Right, you're involved in that Your Doc's In thing.
We are, yes.
Where that's an idea to keep people out of the emergency room, to get them, oh, I've got really bad poison ivy, I can't sleep. You might not need to go to the hospital for that, but there is someone who can help take care of you, and you've made a partnership there.
Yeah, we, it's probably worth noting we're doing about 93,000 emergency department visits now. Which is a lot, quite frankly. And a good portion of those, anywhere between a third and a half of those, could be treated in urgent care settings. So really, we got to engage the community. So we made a decision about a year or two ago to say, okay, do we build up urgent care centers, or do we find someone who's doing it well? Thus, we met with Dr. Walt Gianelli, who has been running Your Doc's In very successfully for a number of years.
He was on the front page of our paper this week talking about the flu.
Yes, yes, exactly. Yeah. So we partnered with him, and right at Salisbury University, across the street from Salisbury University, we opened up our first joint venture together. And then over time, we plan on further expanding the partnership as well as the number of locations, because again, 95,000 ER visits, we need to reserve that space for the stuff that's more complicated, and urgent care is a great setting, and Dr. Gianelli does a wonderful job.
And then you've opened these other, I forget what they're called, the medical offices that are out. There's one in Millsboro, there are two in Ocean Pines now.
What we've noticed, and I think the industry's noticed, is that when you provide care closer to home, people are more likely to engage. So the idea of everyone coming to Salisbury, really, it's just not always realistic. So we started opening up ambulatory campuses. The first one was in Millsboro, right on 113, and then the second larger one is in Ocean Pines, right off Racetrack Road 589. So we've had great success in the community really wanting more and more services closer to home. So we're excited to be able to offer those, as well as a number of other locations with our Peninsula Regional Practice Group, our employed physicians. Those will be important in the future.
And the new cancer center is just open.
Yes, definitely. Quite a bit of the folks coming here for treatment were from Worcester County or Lower Sussex. So yeah, back over the summer, we opened up the second campus for the Richard A. Henson Cancer Institute, and that's been tremendously well received. And when you have to go through pretty long, whether it be IV infusions, chemotherapy, long treatment plans, it's great to have that right close to home in that part of Worcester County.
Right, and also the breast cancer center on Snow Hill Road I hear so many great things about that.
That is, I can't tell you how proud we are of that. We probably don't talk about it as much as we should, but that was a tremendous success at a number of different groups coming together to provide what is truly a remarkable product for women who are at high risk for breast cancer. If you think about it, there's two different surgery groups there and a radiologist there, all in one site. So you can go from an exam to a biopsy in an incredibly short amount of time, all being done right there in one location. So if you think about 4 different companies, 4 different organizations coming together to say what's the right thing to provide for women, that's a great center for those who are especially at high risk.
And it's a great stage for my friend Dr. David Walker, who I hear nothing but great stuff about. He's like the guy in Salisbury for breast cancer, and just in terms of his ability with the patients as well as his skills.
Yes, definitely. They're both, the folks that operate out of that center are wonderful.
The other thing I noticed, I've spent some time with friends recently in the Henson Cancer Center there at the hospital while they're having treatment. What an amazing room that is, and the vibe that's in there, all the positivity and the interaction and the intimacy that goes on. It's
just in the infusion area.
Yeah. It just blows me away at what a really nice experience it can be, and it's kind of a dire situation for so many people.
As hard as it is to go through that, I'm sure for folks, if you think about it though, it's a wonderful nursing team that's there, but it's also a bonding experience for those patients who are going through it together. So I think that's what you see, is that positive energy, the bonding, people get to know each other. That's why they tend to be a little bit of an open feel to them. And, it really is good stuff that happens there. Yeah,
the families, how they talk over to each other, and the nurses are just incredible. And I would think I would want to go in there and be like, just leave me alone. I got all this stuff that I'm up against. But it's not like that at all. It's not like a party atmosphere, but it's a very positive, community sense in there.
I think I wouldn't be surprised if people start out perhaps with that idea, but
Right.
when they get in there, I think it's part of the treatment plan is really engaging.
Yeah.
And it's not just with the medications, but it's emotionally connecting with people and being supported by the team.
They just won't let you be grumpy.
Leave grumpy at the door.
Now, I've been through some stuff. I've had 2 heart surgeries or 3 heart surgeries here.
Like an expert.
In recent months. So I've been, unfortunately, I've been very involved in the hospital as a patient. And I can't say enough great things. But the one thing that's completely different from the old days is the follow-up. Someone's calling me all the time to find out how I'm doing. You all really seem to care about how I am.
It's probably something we have to get better at, because sometimes we get that comment. I had like 3 people call me.
Yeah.
So we definitely need to be doing that. So it's not like when in the old days when you left, okay, see you later type of thing. No, we want to make sure that you're doing well for an extended period of time, because it's not just what happens during an event like that or during surgery. It's the rehab afterwards, it's the diet, the nutrition, following up on a plan of care, and we want to make sure folks not only have the benefit of the expertise, but really that benefit is better when you follow the long-term plan towards health and wellness. So, that's the reason for the calls. Trust me, I know we probably could get better at coordinating them, but that's why they're there.
Well, Dr. Sylvia, your chief medical officer,
officer.
I was interviewing him one time, and he said that under the law, you all are responsible for a patient 30 days after they left the hospital. Like if they're hit by a car, it's your responsibility somehow. How does that all work?
We probably need another show, but let's just say this: it's almost like a warranty in some ways, just like any other industry. Where if you get something fixed, you really don't want to come back again. And actually, part of the reimbursement process places some of that onus on us, so
Right.
that we need to make sure that people stay well afterwards. And it is true, believe it or not, if you have surgery for a hip replacement or something, if you get hit by a car within 30 days, yes, it's a free treatment, which it's just strange, but that's the way it works.
Right. And one of my procedures was like 32 days later, and I was like, "Ooh, I wish I'd had it within the."
Yeah, that's
maybe it would have been, but it wouldn't have mattered.
Yeah, probably not.
Yeah. Now, money is so important in the system. It's all we hear about, especially with the Obamacare and the changes. Your predecessor used to really pontificate about lots of fear about the future in Maryland with the change, with Medicare and Medicaid. What's going on out there? Is there anything really to fear?
I think the team and the public needs to know we'll figure the equation out. But there's always pressure. Maryland, because of the regulatory environment, we're very fortunate. We have what I call a very strong savings account. So financially speaking, we've got a great credit rating and we've got a significant savings. Yet the checking account, as I say, Maryland pushes a lot down on that quite a bit, as with us as with hospitals throughout the state. So we don't make a lot of money, and each year we're faced with more and more choices about what to get into, what not to get into. We always have to find ways to save money. So I don't think it's anything new. I think Maryland is going through an evolution with their demonstration project, as we call it. It used to be called something else, but now it's a demonstration project. We just concluded, or in the process of concluding, the first 5-year phase. And that's getting ready to start another 5 or 10-year phase. So they're going through the approval process right now with the state, and the state's going through that with the federal government. And that's taking some time. So I think there's probably a little anxiety at the state level as to how this is going to unfold. I think people are confident that it will likely pass, yet at the same time, I think it's also fair to say that with this particular administration, not everything plays out like you might expect it to. So you have to start thinking about what happens if it doesn't,
Right.
If it doesn't unfold and we end up going down a path where we become like the other 49 states, less regulated by the state, more free market.
Right. Where does our hospital rank in the state? We're like number 7, 6?
All different size metrics. I think we're the 8th largest system, from a size perspective. It's fairly large. I'm more proud of some of the quality things that we've been ranked on recently.
Yeah, I've just reading the paper. There's been 2 great reports.
Yes.
One a Medicare report, another overall patient report. Tell me about that.
So we, in late December, we found out that we were ranked 5 stars by the Center for Medicare and Medicaid Services.
Congratulations.
Medicare. Yeah, that was pretty. I think we often, and the team always we always have our head down doing the work, and This one kind of caught us off guard, as we always are looking to improve. They said, hey, you're 5 stars, which placed us in the top 10% across the country. There was 377 other hospitals that had 5 stars. There were 4 in the state of Maryland, and our friends at Frederick were, on the western side. Then there was a couple in Baltimore, but the larger academics, no one else on the Eastern Shore were close, which we were pretty proud of. And again, I think that comes back to the team.
Yeah. And then another one just here recently.
Yeah, if that wasn't enough, we Health Grades gave us the Distinguished Hospital of Clinical Excellence, which places us in the top 5% against the Health Grades population. Again, both populations about 4,000 hospitals, so to be in the top 5 or 10%, I think is it's a wonderful thing, and the team's doing a great job, and something the community can be proud of.
So does it help the team more, or does this filter down to patients that they feel like they feel good about their hospital?
I think there's rating agencies out there. Health Grades is one of those independent rating agencies that I think some portion of the population reviews these types of things. But in reality, I think people sometimes go where it's close to home, or if they have particular emergencies. If you have a cardiac issue, there's only one place to go here on the shore, and that's us. So I think the ratings probably don't help that, and we do just fine. I look at it as something that reaffirms what our team's doing, and that's it's one more opportunity for us to say thank you to the team, and for the hard work that they do each day.
Yeah, well, even the specialization with the Guerrieri Heart Institute, you're treated as a sort of a different patient when you go in there, as opposed to someone going in to get their gallbladder out. I think it's a kind of a different experience.
It is the Heart and Vascular Institute. In orientation with new employees, I talk about how that really set us on a different path, quite frankly. And it goes back to Dr. Woods and Dr. Nevins Todd, Michael Butchness, who started Open Heart here back in 1974.
Right.
When you think about us doing open hearts for as long as we have, that one specialty led to just expansion after expansion in terms of specialty, which really contributed us looking the way we do as compared to any other community hospital. We are the tertiary referral center where the complex stuff comes. And, you can look back to the early 70s and thank the folks who were doing really complex things for a community hospital at that point. Hopkins had just started a few years earlier. So pretty incredible. And then today, Guerrieri, we do 400 plus hearts every year, minimally invasive surgery, incredible robotic work, and that's the team that's there.
Yeah, it's amazing that you guys will identify needs. I think the example I used was the DaVinci machine. Dr. Edney wanted one for a long time, and you guys basically got him one, and he uses it. He's one of the experts in the country with the thing.
Yeah.
And it's just a fascinating transition and just how cool it is.
Yeah, it's when folks come out of fellowship these days, they're exposed to the latest technology, and these things have an impact on care. And Dr. Edney, when he came here from Dartmouth, in the mid-2000s, had talked about bringing the DaVinci robot for, at that point, minimally invasive prostate surgery. Prior to that, it was open. And complications afterwards, length of stay, everything. And it was amazing how fast the industry turned towards minimally invasive approaches. But if you look at where that robot has been applied with other specialties, that's equally amazing. You got Dr. Wayberg doing minimally invasive lobectomies for lung cancer patients. So instead of large incisions and opening up the chest, you're able to do it through small incisions, and the patients stay a day or two, and the outcomes are incredible. GYN surgery, general surgery now. Dr. McCutcheon, Dr. Chin, and others are using the robot for complex general surgery. So it takes what are very incredible physicians and makes them that much more impactful because of its minimally invasive approach.
Yeah,
And,
they did my gallbladder as outpatient.
yeah, so it's good stuff,
Yeah.
And I think, in 10 years we're going to look back and it's just one more thing we're going to say, wow, we used to, the doctors used to do what, as opposed to now we have 2 robots actually. We got a new one last summer as well. So the one that Dr. Edney brought was that was traded in, although we kept one arm of it to show as a demo, just to put the class. But we have 2 newer robots now, and they're busy, each and every day. They're, the surgeons are using them to do great things.
Yeah, I remember you were about to get the DaVinci, and there was a big article in the Wall Street Journal about these things are nice, but are they really worth the money and all this stuff? And I remember reading that. And then a couple days later, there was a rebuttal in the letters from Dr. Edney explaining why it was worth it. And his rebuttal was written way better than what the reporter had written in terms of I was like, wow, this guy really knows his stuff.
He's good.
You know, right here in Little Salisbury,
Yep.
you know, he's arguing with doctors all over America about what kind of systems are the future. And I was just so impressed by that. I really was.
Well, if you look at our team, you know, whether it be him from Dartmouth, University of Maryland, Hopkins, Dr. Bothwell Lee from Princeton, we have really smart people here
Right.
who are doing great things, and it doesn't surprise me at all. And sometimes that happens with new technology, where at first it's, you know, the jury's out, but you know, now you wouldn't have it any other way, quite honestly.
One of the things in your job that I think would be awkward, personally, you have to go out and raise money. You have to be a fundraiser guy. Your predecessor was real good at that. She could host a great party. What's your thought about that? I mean, are you going to be able to do this?
You know, it's an interesting question. We have a foundation, which Denise Billing heads up that foundation.
And they work so hard over there.
And it's chaired by Leighton Moore. And, you know, they make it easy. I got to tell you, you know, they make it easy because it's organized. They know where to go. Plus, quite honestly, it's easy selling something great, you know, and, you know, people tend to want to be a part of it and really help us even do better. So, you know, it's if I have my choice, I'd rather be in the building helping the team out, take care of the patients, but at the same time, right, it's part of the job, and you know, getting that message out there to the community. And you know, I think when people hear the message, not to mention we have some folks who have just for many years been really strong contributors to us organizationally. It's not a horrible thing to do to go through.
Right. And Leighton, of course, puts his money where his mouth is. He had a tremendous contribution in the last 2 years for the mental health aspect of the hospital.
A couple different areas.
But you don't hear about the mental health thing as much, and he really brought attention to that.
Yeah, and thankfully so. And I think you're hearing more and more about it because just the prevalence of it out there. So he had donated money to the adolescent and partial hospitalization program. So we have an ambulatory clinic inside the building that does outpatient work for children and adolescents. And then he also supported us creating a dedicated space in the emergency department that's what I call kid-friendly for behavioral health-related emergencies.
Right.
And then the next effort is we're getting ready to apply for a certificate of need where we're going to be building out a inpatient child and adolescent unit to really round out the services. And he's been a champion along the way and engaging and participating with us in terms of engaging the community. And, you know, when you think about the prevalence out there, it's much like hearts were back in the 70s. It's something that we feel obligated. We need to get in and help the community work through.
And he makes a great pina colada.
You know what? He does.
Now, when I was at University of Maryland College Park, whenever there was a blizzard, one of the things I would do was donate my time to drive doctors around. And I thought it would be a cool, fun way to get to know doctors and help the community. But the doctors I dealt with really treated me as a driver, as like a servant. They weren't going to be my buddy or anything like that, which I don't know what I was thinking. We had a blizzard here recently, and I understand that you got sort of drafted to drive doctors in and nurses.
That was my first day officially in the role, January 4th. I won't forget the date. Actually, since my wife and I moved here, I've always participated. We have a pool of folks who drive in the snow, and I've always had, you know, what tends to be a larger four-wheel drive vehicle, and we're from upstate New York, so, you know, as soon as you can
Not
walk,
intimidated by the snow
yeah,
at
as soon
all.
as you can walk, they're throwing you in the snow. So yeah, my first day, it was nice. We got to cancel a bunch of meetings, and you know, I continued what I've been doing for years, and I'm driving folks to work. I can't do surgery, but I can get people there to help, and you know, it's great though having the time with the team, quite honestly, and helping them out when they need it to get in or get home. We drove people home as well. Although I have to say, you know, it's always entertaining some things that folks say, like, "Where do you work?" You know.
Well, you're kind of low profile.
Well, I don't get recognized in my snow attire, and they're like, "Oh, what do you do at the hospital?" So I always find that's always a little entertaining.
Do you actually sign the paychecks? Can you say, "I signed your paycheck"?
I didn't say that. I do. I guess I do. But yes, but I didn't say that. So.
Well, we're thrilled to have you here.
Yeah, thank you.
We hope you're here many years, and gosh, I can't imagine how hard your job must be some days.
You know, it's an honor and a privilege, and you know, we had a great team. So I'm looking forward to the challenges and helping this organization to continue to grow and evolve.
Well, welcome. We love your hospital. We're all behind you, and it's just going to be a great thing.
Well, thank you very much. I appreciate you taking the time to ask.
I'm Greg Bassler from the Salisbury Independent newspaper. Another edition of One-on-One right here on PAC 14.
First Shore Federal is proud to support PAC 14 and one-on-one. We'd encourage every business to support PAC 14 and pick a program and support it, and let's make a difference.